Nurse Eileen Kendrick is an assistant practitioner in the NHS. Here at Chorlton Good Neighbours, we just know her as Nurse Eileen. She's been coming every fortnight to Good Neighbours to the Thursday coffee mornings. When she comes, she goes from table to table to check up on any health problems that our members might have and see if she can help in any way. The only time she wasn't able to do this was during the lockdown that happened during the COVID pandemic. In fact, there used to be several such nurse practitioners visiting local community groups, for example, the Trinity House in Rusholme, the Afro-Caribbean Centre in Hume and the Boiler House in Moss Side. When lockdown ended, community engagement sessions, as they were known, did not restart except for Nurse Eileen, who successfully pressed for them to continue at CGN because of how useful she thought they were. So when she comes to the Good Neighbours coffee mornings, she goes from table to table, talks to the older people, many of whom she knows from many years of going there. And each fortnight when she sees them, she speaks to about 8 or 12 different people who've got particular medical issues. They have an individual talk with Eileen, and then she recommends what they do. It might be something personal, might be to go to the chemist, might be advice to get to the GP, and whatever. Now, many of the older people are very reluctant to go to their GP. They often find it very difficult to get an appointment, and then when they do get one, it's difficult to get to the surgery, so they tend to put things off. Eileen is expert at noticing problems which could turn serious. She will give advice where necessary, collecting urine samples, testing them there and then, and working out from that what the problem might be. And what she acts as is an early warning system. She gets to know their problems, and with the person's agreement, the information she's found and further action needs to be taken, she puts on the EMIS healthcare record system that local GPs use. Eileen feels very strongly that these fortnightly sessions are important and should continue. We at Good Neighbours strongly agree. However, we're all aware of the intense financial pressures on local NHS services, where funding is being slashed, such that Nurse Eileen is under increased pressure to end the sessions at Good Neighbours. What we want to argue is that this will be a false economy, as well as providing early diagnosis of health problems that might otherwise become more serious and more costly to treat. Last week, when I was thinking about this at a CGN coffee morning, Nurse Eileen came up to me and mentioned that a coffee morning regular, let's call her Maureen, who had not turned up, but her neighbour had, and her neighbour came with a message from Maureen that her leg was hurting very badly and she couldn't walk. She tried to get a GP appointment, but only got one for several weeks later. So, there and then, Nurse Eileen walked across the road to the local GP, which happened to be just across the road, and managed to get Maureen a telephone appointment the very same afternoon. We're making this short video to show our appreciation of Eileen and the variety of things that she does for us. But we also want to say, please don't cut the service we get from her. We think she does a fantastic job. Thank you.